Navigating a product recall requires meticulous planning, swift action, clear communication, and unwavering commitment to consumer safety and regulatory compliance. So first, what is a recall? Food recalls are removals of foods from the market that are in violation of the U.S. Food and Drug Administration's (FDA) regulations. FDA regulates all foods except meat, poultry, and processed egg products, which are regulated by the U.S. Department of Agriculture, USDA. It is important that consumers be aware of recalls because recalled foods may cause injury or illness, especially for people who are pregnant or have weakened immune systems because of chronic illness or medical treatment. Food recalls are usually voluntarily initiated by the manufacturer or distributor of the food. In some situations, the FDA may request or mandate a recall. There are instances where the violation can be corrected and the food returned to the marketplace. Recalls are different from a market withdrawal, which applies when a shipped product is found not to meet safety requirements, is deemed not suitable for sale, and is removed from the distribution chain before it has reached the consumer. There are several reasons that food recalls occur. Food recalls address situations where a product is adulterated, contaminated, or mislabeled. Common reasons include contamination, the results of the presence of harmful microorganisms like Salmonella, Listeria, or other bacteria, viruses, or parasites. Foreign objects, the contamination with physical items such as glass, metal, or plastic fragments. Undeclared allergens, the result of failing to list a major allergen, like nuts, eggs, or shellfish, on the product label, which can cause life-threatening reactions in sensitive individuals. Mislabeled products, when a product is incorrectly labeled with incorrect ingredients or misleading information. And violation of food safety laws, which are products not manufactured according to food processing laws or regulations. In the U.S., the Food and Drug Administration provides guidance on what size and type of hard or sharp foreign objects in food that will trigger a recall, depending on the product and its intended consumer. According to the FDA's Compliance Policy Guide, a food is considered adulterated with a physical object, which can lead to a recall, under the following criteria. Objects over 25 millimeters. Any hard or sharp object over 25 millimeters, about 1 inch, in length is grounds for a recall. Objects 7 to 25 millimeters. Objects between 7 millimeters and 25 millimeters, about 1/4 to 1 inch, can initiate a recall. For products that require further preparation, like sifting or cooking, the recall decision depends on whether the processing step would likely remove or neutralize the object. Objects under 7 millimeters. Objects less than 7 millimeters, less than about 1/4 inch, are typically not considered a significant health hazard unless the food is intended for a special risk group, such as infants, young children, or the elderly. In these cases, the smaller object can initiate a recall. Food recalls are categorized by the level of health risk they pose. The categories are: Class 1. The most severe class, meaning there is a reasonable probability that the product will cause serious adverse health consequences or death. Examples include a food contaminated with dangerous bacteria like Salmonella, or a product adulterated with glass fragments. Class 2. Issued if there is a remote probability of adverse health consequences from the product. Examples include a food product with metal shavings, or a candy with an undeclared dye. And Class 3. The food will not cause adverse health consequences, but it violates a food safety law or regulation. Examples include a minor container defect or a lack of labeling on food. Market withdrawals. A market withdrawal happens when a product has a minor violation not subject to FDA legal action or when the issue does not involve health risks. Some requirements for the product removal from the marketplace to be categorized as a withdrawal versus a recall are: the company voluntarily removes the product. The FDA is not involved, typically when the issue is not a regulatory violation affecting safety. And the removal is not listed in the FDA's recall database. Examples of a market withdrawal include a labeling error that does not pose a health risk, quality issues, such as off-taste or color defects that do not affect consumer safety, and routine stock rotations. So, who are the participants involved in a product recall? Manufacturers and distributors. They typically initiate the recall voluntarily to correct or remove the problem product. And regulatory agencies. Agencies like the FDA for most foods or the USDA for meat and poultry monitor recalls and can request them if a company fails to act. Recalls can be initiated for one of the following three reasons. Voluntary recalls, usually initiated by the manufacturer, distributor, or retailer. Requested recalls. FDA may suggest or strongly encourage a recall. And mandatory recalls. FDA can legally order recalls in limited cases. Once a decision to recall a product has been made, the following actions must be taken. Promptly notify the FDA District Office. The company must notify the FDA District Recall Coordinator immediately once a decision is made. The caller must provide product details including product name, lot numbers, quantity distributed, distribution chain, and reason for recall. The FDA's responsibilities during a product recall are to evaluate the health hazard, assign a recall classification, post recalls in the FDA enforcement report, and verify recall effectiveness and termination. The company must immediately cease distribution, sale, and consumption of recalled products. Then run a traceability exercise to determine where all the affected products are, both internally and externally. And remove products from shelves, warehouses, and inventory and secure them in a controlled area to prevent further distribution. The company must develop and implement a recall strategy taking into consideration the scope, depth, recall team, required public warnings, and status and update check system. Recall team formation. Establish a multidisciplinary recall team with clear roles and responsibilities. Designate a recall coordinator to oversee the recall process. This will be discussed in more detail on the next slide. Communication plan. Develop a comprehensive communication plan for internal and external stakeholders. Communicate transparently with regulators, media, and consumers throughout the recall. Notify direct accounts and customers. Coordinate with distributors and retailers to retrieve recalled products. Establish a return process for consumers to return affected products. Provide clear instructions to consumers on returning or disposing of recalled products. Address consumer inquiries, concerns, and complaints promptly and transparently. It may be beneficial to set up a hotline. Documentation and record keeping. Maintain detailed records of the recall process, actions taken, and communications. Ensure compliance with regulatory reporting requirements and documentation standards. Monitor recall effectiveness. The status of the recall must be tracked and reported to the FDA's District Recall Coordinator. The essential roles and responsibilities of a recall team include Recall Coordinator, a dedicated project manager responsible for overseeing the entire recall process. Management and legal. Top management holds the ultimate responsibility for the recall action and must be actively involved. And legal counsel provides guidance and ensures compliance with relevant laws and regulations. Quality assurance. Ensures the product is correctly identified, isolated, and that corrective actions are taken. Operations and distribution. Manages the physical movement and return flow of recalled products from the supply chain into their correct destination. Customer service. Serves as a direct point of contact for consumers, handling inquiries and providing information. Marketing and public relations. Manages internal and external communications, including media and public messaging. Accounting and finance. Deals with the financial aspects of the recall, such as reimbursements or replacement products. And information technology, or IT. Supports communication and record-keeping systems needed during the recall process. Once the recall activities are under control, the post-recall actions will be initiated, including completing a root cause analysis and corrective actions. Investigate the reason for the issue leading to the recall by performing a root cause analysis. Then implement corrective actions to prevent future incidents. Crisis communication. Management and legal counsel will work with the public relations team to manage media inquiries and public perception. It is important in all communications to focus on transparency, accountability, and commitment to consumer safety. And reputation management. Implement strategies to rebuild trust with consumers, stakeholders, and the public. Demonstrate proactive measures, continuous monitoring, and dedication to quality assurance. Subscribe to Food Short to see the root cause analysis and corrective and preventive actions video for in-depth training on these topics. A comprehensive food recall procedure includes a written recall plan with defined responsibilities, a trained recall team, robust traceability systems, and a step-by-step process for identifying and removing affected products. Key components also involve effective communication with regulators, stakeholders, and the public, as well as thorough record-keeping, product disposition, and follow-up verification to ensure the recall's success and prevent future issues. The components of a recall procedure include 1. Preparation and planning. Written recall plan. A documented, logical step-by-step procedure for recalling a product. Recall team. Assembling a cross-functional team with clear roles and responsibilities for each member. Traceability. Maintaining detailed records of raw materials, packaging, and finished products to quickly identify affected lots. Technology. Utilizing technology and food safety software for real-time end-to-end visibility of products. And mock recalls. Regularly conducting practice recalls to test the effectiveness of the plan and team readiness. 2. Activation and identification. Recall trigger and decision. Determining if a recall is necessary based on risk assessment. Product identification. Pinpointing the specific product, batch codes, and production dates of the affected items. Risk evaluation. Assessing the health risk associated with the deficiency. And location of product or products. Identifying all locations where the affected products are located, from production to consumers. 3. Execution and communication. Isolate affected products. Separating and controlling the recalled products in a designated area. Notify authorities. Informing regulatory bodies like the FDA of the recall and its scope. Communicate with stakeholders. Alerting direct customers, consignees, distributors, and, if necessary, the public through various channels. And provide clear instructions. Giving direct consignees specific instructions on what to do with the recalled food. 4. Control and disposition. Control recalled products. Implementing measures to ensure recalled products are not returned to the market. Document disposition. Recording the disposal or corrective actions taken for the affected product. And monitor inventory. Tracking the amount of product removed from the distribution chain. And 5. Verification and follow-up. Recall effectiveness verification. Confirming that the recall has been successful in removing products from the market. Reintroduction of product. Developing a strategy for safely reintroducing the product to the market once the issue is resolved. Root cause analysis. Investigating the underlying cause of the problem and implementing corrective actions. And plan refinement. Using data from the recall to improve and update the recall plan. Preparation is key for recall readiness to manage product recalls. It is critical for companies to be recall ready so that they can act quickly and effectively to protect the public from violative products on the market. It is important for a company to monitor recall trends, regulatory updates, and industry standards to stay informed. Engaging in ongoing training, education, and collaboration to enhance recall preparedness will aid an organization in its preparation. Training and testing should be conducted to ensure the company is prepared to conduct a recall. The emergency response or recall team must be trained on their responsibilities. Conduct recall training exercises for staff to ensure readiness and response efficiency. Test the recall plan through simulations and scenarios to identify gaps and areas for improvement. Many certification standards, like BRCGS and SQF, require periodic traceability exercises including forward and backward trace drills to validate the company's ability to demonstrate they know where raw ingredients were used and where finished goods are or have gone. Navigating a product recall requires meticulous planning, swift action, clear communication, and unwavering commitment to consumer safety and regulatory compliance. Preparation and training are the keys to being recall ready. We hope you found this training valuable. Please click the subscribe button to access additional Food Sure training videos.